Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Greece donates about 1 million doses of the Johnson & Johnson COVID-19 vaccine to Nigeria. And controversy trails decision on call-off of warning strike by nurses and midwives in Oyo State. Australia COVID-19 infection surpasses 1 million as Omicron drives record surge. Thank you for joining us. As academic activities resume in most parts of the country, the Nigeria Center for Disease Control is asking school owners, parents and guardians to ensure the proper implementation of COVID-19 protocols to prevent the spread of the virus. In its guidelines, it advises that a triage point be identified and well marked at the entrance, where everyone gaining access to the school is screened for high temperature, requested to wear masks and perform hand hygiene. In the meantime, the daily count of COVID-19 cases witnessed a decline last night as the NCDC reported 537 new cases and 6 deaths from COVID-19 complications. Here's more on the pandemic update.
537 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT, indicating a drop from the figures reported earlier. Rivers accounted for the highest number of cases with 313 infections. Lagos had 178, FCT 19, while Kaduna registered 11 cases. Gombe and Ogun registered 6 cases each. Ekiti had 3, while Abia logged 1 case. The total confirmed cases in Nigeria now stands at 248,312. 570 patients have been discharged in the last 24 hours. There were 6 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,077. Currently, there are over 26,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. Almost 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.2% of the population have been fully vaccinated. The total global confirmed cases have surpassed 307 million, while deaths are beyond 5.4 million.
Those are visuals of a rowdy scene at the Congress of the Lagos State Council of the National Association of Nigerian Nurses and Midwives in Lagos. The nurses and midwives who gathered at their secretariat in Ikeja denied resolving to call off their 3-day warning strike. Most members rose up against the state executive that had extracted a commitment from the Lagos State government over some of the requests tabled. And one major issue which has contributed to a stalemate is the issue of retention wages for the workforce.
I felt bad because we've seen that nurses, they are already bottled up, and you can see the aggression here. So even reading the message from the governor, they don't want us to say anything, that until everything is being implemented, that they don't want to hear governor has said, governor has said. So that's what is causing the disruption now. But we keep on telling them because the governor gave his words and he has always acted on his words. But the way the Congress is taking everything, I don't think they're ready to listen to anything.
So that
because
means
the aggression.
That you're still going to proceed with it?
Well, it depends on what they say. Because they are ready to be here till, when we meet a stalemate like this, they can be here till 12 midnight.
And Greece has donated about 1 million doses of the Johnson & Johnson COVID-19 vaccines to Nigeria to boost the vaccination drive. Greece's Minister of Foreign Affairs, Nicholas Dendias, disclosed this during a meeting with his Nigerian counterpart, Mr. Jeffrey Unyama, in Abuja. He says Nigeria and Greece have enjoyed a favorable relationship over the years and that his country is even willing to expand the relationship, which will culminate in the signing of a memorandum of understanding on various issues.
I'm happy that I'm symbolically bringing with me a present to the Nigerian society and to the Nigerian people. And this is almost 1 million vaccines. All the world is... Thank you. So all the world is suffering for COVID-19, all of us. But there is one huge achievement through this suffering, that we clearly understand, all of us, that we're a world community, that nobody's safe unless everybody is safe, and that health is a global good, and all of us are under the moral obligation to be providers of help whenever and wherever assistance is needed. So I'm so happy to make this small contribution to the Nigerian people.
We received with very much gratitude the donation of the Greek government to Nigeria of almost 1 million vaccines for in our fight against COVID. And thank you very, very much indeed, Your Excellency, for this generosity. Of course, COVID is a global challenge, and I think by this gesture, the Greek government is showing that they see COVID as a global challenge and the response to COVID as a global responsibility.
And over 400,000 people in Kwara State have been vaccinated since the outbreak of the disease, which is 11% of the residents in the state. The state's executive secretary of the Primary Healthcare Development Agency stated this while addressing journalists on the vaccination sensitization.
Kwara State is dealing with its own COVID-19 vaccination challenges, with less than 500,000 residents vaccinated since the outbreak of the disease. The health authorities in the state are not encouraged by this figure, which is just 11% of the population. New strategies are being put in place to scale up vaccinations, with centers established throughout the state around schools and markets.
We have activated several sites, which we refer to as the mass vaccination sites, that are scattered across various large population density areas where you have sites like the one similar to the front of my office at the State Primary Healthcare Development Agency, where we have over 15,000 people who have been vaccinated in the last few months. We also have some new sites at the Palms Mall, where we also have a significant number of people that have come to shop, also getting vaccinated, at those sites. We also have some strategic locations in our marketplaces like the Ojoba Market, Okuta Market, Ikpata Market, Mandate Market, and also in some of our higher institutions like the Federal Polytechnic, the State Polytechnic, the Kwara State University, etc.
For those who want to receive their booster shots, more than 90,000 doses are set to be available in the state.
People that have had their second shot that over 6 months for AstraZeneca are now eligible to come forward for a booster dose of COVID-19 using the Pfizer vaccine. So in Kwara State, we have over 90,000 doses of Pfizer vaccines that are so far available in our central store. And as soon as we exhaust those, we also have additional doses coming in.
There are varied reactions to the COVID-19 vaccination, and health officials are tracking residents who have recently received the shots. And still, there's strong advice to residents to protect themselves by adhering to COVID-19 safety protocols.
Well, joining us for more to talk about the mass vaccination drive in the country is a public health physician, Dr. Shalom Oni. Thank you for joining us on the program. So, Dr. Oni, let's begin. Some states are experiencing hesitancy in meeting their vaccination target. How do you think states can address this vaccine hesitancy challenge?
Yeah, good evening, everyone. Thanks for having me, Millicent. Well, in addressing the vaccine hesitancy challenge, I think the government needs to first of all come out, and address, the masses, speaking to the effectiveness of the vaccine, and how it reduces the severity, of COVID-19 infection. Now, what many people have, which I've discovered, that looks like a paradox to them, is that how can someone receive the vaccine and still come down with COVID-19? So we all need the government to come on tops, to educating the masses, to ensuring that they get the right message. Because when they don't get the right message, then there will not be uptake of the vaccine. So what the vaccine actually does is that it reduces severity of COVID-19, infection in individuals who come down with the infection. So it's not per se, 100% protective. The government really needs to come out on this. They need to hear, the public need to hear this from the government, so as to restore confidence, and so that people can know what they are getting themselves into.
What some states are doing, Taraba State, for example, going a step further to vaccinate its students who may either have to present their test results for COVID-19 or their vaccination cards before being allowed to the school premises. Do you think that proposal as a requirement for school is also one way to go?
Well, it's a bit controversial. And how do I mean? Number one, you don't force vaccination on people. And you don't issue threats when it comes to vaccination, because you have to have a respect for human rights also. But by and large, there's a line between when an individual poses a nuisance to the community, when an individual's unimmunized state poses a nuisance to the community, and and the human rights of that individual. So the government really needs to look within, and to maybe conduct some more survey, and even need to consult widely, before issuing threats, to individuals, or using COVID-19 vaccination card, as a requirement, for school admission, as a requirement to working in offices, because this could actually boomerang. Don't forget that we also have the religious, sector who have not fully bought into the COVID-19 vaccination. So we don't want a scenario whereby we're going to be having, anarchy on our hands, where where the individuals, the narratives, out there, the government is going to be playing into the hands of the masses, and based on the narratives and conspiracies have already gone ahead of the COVID-19 vaccine.
I also know a number of physicians who would disagree with you on vaccine mandates, but let's look at what other states are doing. Oyo State, for example, is rolling out mobile vaccination teams at strategic locations. We have Oyo State that has recorded about 4.1% vaccination coverage, and this was after it increased its centers from about 53 to over 150. But we know that Lagos has bigger numbers in terms of confirmed cases, in terms of deaths, and of course, a big population. How do you think the state is doing in terms of ramping up vaccination?
Yes, as far as Lagos State is concerned, I know that there are a lot of effort has been made, number one, to increase vaccination centers. First of all, there's what we call the mobile vaccination teams, who are manning different wards and different communities, across all the local government and SCDs in Lagos State. I also know of the mass vaccination sites also. These are individuals who stay at busy junctions, across all the busiest terminals, across the bus stops, motor parks, in Lagos State. That has been another drive, that Lagos State has also initiated in the last 2 months. Also, the private sector has bought into the COVID vaccination also to capture the airlights.
All right. Hello, Dr. Oni. Okay, we appear to have lost you, but we'd like to appreciate your time. Thank you so much for joining us on the program. Well, still to come, Oyo State government fails to meet the 2 million vaccination targets. We'll find out why after the break. Welcome back. The Oyo State government says it has failed to meet the 2 million vaccination target for itself in the mass vaccination drive, saying hesitancy among residents was largely responsible. The State Commissioner for Health, Dr. Tomi Koka, while speaking to channels television in the state capital, so far informed that over 470,000 people have been vaccinated, which represents about 25% of the targeted figure. While promising that a more practical and strategic plan is being worked out, she, however, said that 350,000 students of tertiary institutions across the state are being targeted to be vaccinated as schools resume from the public holidays.
The mass vaccination campaign flag off. His Excellency said we were targeting 2 million, but so far we've vaccinated 470,507 individuals, which means we're around about sort of 20, close to 25%. Our hope is that in the forthcoming 2 weeks, we can actually boost that number because, as you know, the tertiary institution, they are resuming. And when they resume, they should have about a population of 350,000 students whom we're targeting. We're strategically targeting those. So we're hoping that that will boost our numbers. Our challenge has been, we've been to all markets, we've been to motor parks, but there's still vaccine hesitancy across the nation. Oyo State is one of the top performing states. We are third in the number of people vaccinated. But even if you look to beyond the 1st of November, if you look as far back as March, we've actually vaccinated over 500,000, close to 1 million people. So I believe that the first early uptakers, we've convinced those. So we need to now apply more strategic plans towards convincing the laggers so that they can also come forward and get vaccinated.
And away from Nigeria, the U.S. is now averaging more than 700,000 new coronavirus cases per day, according to analysis from the Johns Hopkins University data. The country reported about 4.91 million cases in the week ending Saturday. That's more cases in 7 days than in April, May, June, July 2021 combined. At the latest pace, 8 Americans are testing positive every second. Each of the last 5 days ranks in the top 5 of the entire pandemic for highest case count. Our Washington correspondent Maria Bird reports that the Omicron variant is quickly impacting the health and economy in the United States.
One of the largest companies on Wall Street in the U.S., Citigroup, takes a hard stand against COVID and implements a no jab, no job policy, which is scheduled to begin on January 14th. While companies like Citigroup are leading the way with private sector mandates on employee vaccinations, the majority conservative Supreme Court is debating the federal government's authority to impose a vaccine mandate.
This is a pandemic in which nearly 1 million people have died. It is by far the greatest public health danger that this country has faced in the last century. More and more people are dying every day. More and more people are getting sick every day. I don't mean to be dramatic here. I'm just sort of stating facts. And this is the policy that is most geared to stopping all this.
While the judicial system continues to debate vaccine mandate policies, hospitals across the U.S. are running out of capacity to serve ill COVID-19 patients.
When we had our first surge, when the pandemic first started, it was nothing like it is today. I would say we're surging more today in this hospital than we were when it all started a year ago or 2 years ago. We notice a lot of, after the holidays, gatherings, like after Thanksgiving, we really imploded. We were full. We had 12 beds full at all times.
The U.S. is pulling all stops to try to end the COVID-19 pandemic, with a major increase in available COVID-19 tests and major vaccine campaigns. From Washington, Maria Bird, Channel Television News.
And Dr. Simon Agwale is the CEO of Innovative Biotech. He joins us now from Maryland in the U.S. Thank you for joining us on the program.
Thank you for having me.
First, I'd like to get your view on the no jab, no job policy. What do you think?
Well, I mean, it all depends. The key thing is that if you look at what is going on, I'm actually in the state of Maryland. Just yesterday, 17,000 people were infected and 54,000 died from COVID-19. So I think that, if you look at what is going on, we of course be in support of vaccine mandates, because almost 75% of the people that are currently hospitalized and the people that are dying are people that are not vaccinated.
So in terms of the numbers that we're seeing, Dr. Anthony Fauci said he wouldn't be surprised at all if the US goes over 1 million cases per day. What would you say is really happening? Is it that people are not getting vaccinated, or we have the Omicron, quite peculiar, that seems to be spreading faster? What exactly?
Well, I mean, the consensus now is that the vaccines actually help to prevent severe disease and death, hospitalization. But if you look at the first generation vaccines, are the vaccines that are currently being used. They have limitations in the fact that they don't prevent infection, and there are breakthrough infections. But the good news is that they prevent severe disease and death. So the second generation vaccines are what are actually needed now. And I think by June this year, you'll begin to see better vaccines coming out. And these vaccines are expected to have a broader protection, and then with long-lasting immunity. So you have a better duration than the first generation vaccines. I mean, if you look at the first generation vaccines, all the data point to the fact that the antibodies wanes after 6 months and you have to be revaccinated. So you know that it's not practical to vaccinate the world every 6 months. So second generation vaccines are targeting to overcome the limitation of the first generation vaccines. But we will encourage everybody to go get vaccinated, because there are advantages to taking these vaccines, and data has shown that with the vaccines, there's this reduction, almost 90% in some cases, reduction in hospitalization and death.
Perhaps a final question. This is what some experts are saying, that it's high time political leaders start talking about what levels of COVID-19 which is acceptable. I think it's a trio of health experts in the medical journal. They say the virus that causes COVID-19 will be impossible to eliminate because they mutate so much the immune system can't protect them forever.
The only way to solve this problem is to get everybody vaccinated at the same time. So it requires that you have manufacturing capabilities throughout the world so that everybody will be vaccinated and we end the pandemic. But as long as some people are vaccinated and then other people are not vaccinated, the virus will have the opportunity to continue to mutate. I mean, as you know, the key players in the game right now, Pfizer, Moderna, are working on Omicron-specific vaccines, and other companies, Johnson & Johnson and so on, and our group. We're all working on Omicron-specific vaccines. So these vaccines will be ready sometimes in March, April, towards June. So what will happen, and again, it's already happening, that the wealthy countries have already bought the initial doses. So the same problem that we had the last time, we're going to have again this time around, because you can see that the wealthy countries have already bought these vaccines, and then based on the contracts that have been signed, these guys are paying you in advance. So you have to supply them the vaccines first before you think of other customers. These are legal documents, and there's no way you can bypass this. So I think that for us to begin to play ball and to have access, immediate access to some of these vaccines, we have to do what the wealthy countries are doing as well.
Indeed, a whole lot more. Thank you so much. We appreciate your time. Dr. Simon Ogwale is the CEO, Innovative Biotech. Thank you for joining us on the program.
Thank you.
And Australia today surpassed 1 million COVID-19 cases, with more than half of them recorded in the past week, as the Omicron variant ripped through most of the country, driving up hospitalization numbers and putting a strain on supply chains. Here's more on the global COVID-19 update.
Australia has surpassed 1 million COVID-19 cases, with more than half of them recorded in the past week, as the Omicron variant rips through most of the country, driving up hospitalization numbers and putting a strain on supply chains. Having successfully kept a lid on its virus caseload through aggressive lockdowns and tough border controls earlier in the pandemic, Australia is now suffering record infections as the country begins to live with the virus after higher vaccinations.
And so we're looking to maximise those who can remain in the workforce. And that is why these arrangements are being put in place. But anyone who is symptomatic or has COVID, they are not going into work.
Prime Minister Magdalena Andersson has announced that Sweden will introduce more measures to stem a rising number of COVID cases that have placed a greater burden on the healthcare system. Sweden has seen the fastest spread of COVID cases in recent weeks, as the Omicron variant has surged through the country. A record 60,000 cases were detected last week, despite limited testing capabilities. Prime Minister Boris Johnson says Britain is making progress against Omicron and is looking at reducing the isolation period to 5 days, though he cautions the number of hospitalized COVID cases was rising.
Our website has lots more updates and a better understanding of the pandemic, plus several other stories, breaking news at your fingertips. It's channelstv.com. And that's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.